The first and most common cause of actual sudden cardiac death in athletes is something called hypertrophic cardiomyopathy. In terms of blood coming into the left ventricle, normal size to the left ventricle, it exits out to go up the aorta and then out to the rest of the body. When someone has hypertrophic cardiomyopathy, what happens is this septum, the muscle tissue here that divides the right ventricle from the left ventricle, becomes really thickened. It becomes hypertrophied. When it becomes hypertrophied, it starts to push on the rest of the structures of the heart, which can lead to impaired blood flow, which ultimately leads to development of an arrhythmia, and the arrhythmia is what triggers and causes the cardiac arrest. One of the treatments for this is to actually go in and do something called a myomectomy, where surgeons can actually remove this excessive amount of muscle in here to try and free up the space within the ventricle. It's not something that you acquire later on in life, but is the most common cause of sudden cardiac death in athletes. The way that we'll evaluate for something like this is sometimes we'll see changes on an EKG where there has been some evidence of a remote infarct or a low level of death to some of this heart tissue.